everyone. So today we will be covering the Prions disease. And this disease is very interesting. We will be covering the disease description, demographics, cause, the pattern inheritance, and some of the ways to diagnose and manage this disease.
Prions disease is a rare disease that can affect both humans and animals. There's multiple types of prion diseases, but only a couple hundred are reported each year. The most common is CJD. Prion is when there is a protein that makes the other proteins in the brain fold. Most of the time, the source of the bad protein isn't known. Some symptoms include brain damage, memory problems, personality changes, trouble moving, hallucinations, stiff muscles, fatigue, and trouble speaking. The most common prion disease is CJD, but as a whole, the prion diseases are rare and only a few hundred are reported each year. You can inherit familial CJD or get sporadic CJD. It will normally affect people who are in their 60s. Acquired CJD is from contaminated tissue during a medical procedure. Death normally follows within a year. Family history, infected meat, or contaminated surgical field in a medical procedure will all put you at a higher risk of getting this. The prion disease can be inheriting a genetic mutation, a familial prion disease, or by being infected by the disease through acquiring the said disease. This is a sporadic prion disease, where an individual does not have either the genetic mutation or exposure. Gertzmann-Straussler-Scheinker syndrome, GSS, is a rare genetic human prion disease that occurs in 1 out of 10 cases per 100 million population per year. GSS occurs as a familial prion disease. Fatal familial insomnia is an autosomal disease that is an acquired prion disease. Creutzfeldt-Jakob disease, CJD, is known to be the most frequent human prion disease. CJD occurs as a sporadic disorder. Prion diseases begin when a brain's normal prion protein, PRPC, changes into prions, an abnormal misfolded form of PRPCS. The abnormal prions clump together or bind with normal prion proteins to make more prions. As time goes, the abnormal prions damage nerve cell in the brain and causes the loss of function to the brain. Some things that can occur is difficulty walking and difficulty with communication.
Prion diseases are inherited in an autosomal dominant manner, with one possible exception, meaning that an individual needs one dominant gene from one parent to cause the prion disease to occur and manifest in their offspring. So, there are multiple ways to detect the abnormal prion protein, one of which is immunoblotting. This is a blot analysis used to detect the disease-causing prion protein in the brain tissue. This method is used to break down the normal prion protein in order to measure the protease-resistant core of the pathologic prion protein. The next one is a prion misfolding cyclic amplification, PMCA, which is the multiplication of the prion protein in a variety of tissues used to detect the appearance of the prion protein. Next would be the real-time quaking induced conversion, which uses shaking instead of sonification to amplify the small levels of PRP, which is the prion protein, by inducing pathologic seeding activity. The real-time quaking-induced conversion can detect abnormal prion seeding activity in the cerebrospinal fluid, which is the clear fluid that surrounds the spine and brain, olfactory epithelium, skin, ocular tissue, and other types of tissue. Sadly, prion diseases can be fatal, and there are currently no treatments available to medical professionals to either prevent or slow them down. Most people with the disease die within a few months to a few years after diagnosis. However, some medical professionals insist on palliative care-focused treatment to control symptoms and make prion disease patients as comfortable as possible. For example, some medical providers would be able to prescribe anti-seizure drugs or muscle relaxants for muscle twitch and opioids for pain. So basically, medical providers just want to be able to relieve the pain that these patients are experiencing, but there are no treatments or no cure available at this moment. So these are some of the resources that we used to gather the information for this research and this presentation. Thank you all for listening, and hope you guys have a good one.